students, welcome to today's class, and we have finished studying about allopathy, then about antipathy. Of course, one more pathy is remaining, that is isopathy, but it will be coming later in the aphorisms. I will not be covering it now. But today we will be studying two aphorisms and aphorism to footnote of 25. So the two aphorisms which we are going to study in this class is aphorism 24, aphorism 25 and footnote to aphorism 25, that is footnote number 30. So then what are we going to study in this class? What does these two aphorisms indicate? So we studied, as I told, about allopathy and antipathy. So in this aphorism, as aphorism 24, Hahnemann tells that why is homeopathy so effective? We have seen the side effects and the problems with allopathy and antipathy. Then the time comes to tell what is so good about our system which makes it so superior to compare to the other systems. Okay. So aphorism 24 and 25 will be covered in this class. So first we will take aphorism 24. So the aphorism 24 tells, among all modes of treatment, why homeopathy is most effective. So we can understand this aphorism giving three reasons. That is why homeopathy is most effective. First reason is because we seek totality of symptom. TOS is totality of symptoms in every case. Second, our medicines are studied on healthy individuals, and third, our medicines create artificial disease which is similar, this means similar, okay, similar to that of natural disease. So these are the main three important reasons which makes homeopathy so effective. If our medicines were tried and tested on creatures or on animals, how do you think it is possible to understand its efficacy? Because they don't have mouth, they don't know how to explain their symptoms. It is studied on healthy individuals, which makes it so effective and helpful in curing the patient. We seek the whole totality of the case and not one troublesome symptom, but whole totality of the case. And third most, our medicines create an artificial disease which is similar to that of the natural disease, because of which it can remove the or cure the natural disease. Then aphorism 25 tells about that all careful trials and pure experience shows that all medicines cure diseases that resemble their own and leave none of them uncured. Because our medicines are so similar to the disease, all our medicine cure diseases that resemble their own. That is, only it cures if it is the most similar and leave none of them uncured. If it is the most similar, then surely it will cure the disease. Then let's see the footnote to aphorism 25. Okay. So, in the footnote to aphorism 25, that is footnote number 13, Hahnemann tells that all our medicines can cure, which can be understood through careful trials and through pure experience, but not like the experience which old school boast about. Now the old school, what is the difference they do? They give so many medicines together, because of which they can never assess that which medicine acts or which is good, which is not good. And the second biggest thing which they do is that other than giving so many medicines together, they expect these medicines to act singly in our body, which is not possible. And they always try to search something imaginary or imaginary morbific or disease agent inside the body for which they want to treat, which they cannot be successful. In this aphorism, in this footnote, Hahnemann tells that it's like seeing in a kaleidoscope for 50 years. So it's like seeing, like old school method is like seeing in a kaleidoscope. I think you know what is a kaleidoscope. Kaleidoscope is an object which has many glass pieces inside it, and you view through a tunnel, and when you view, you can see that each time you turn, it makes a different pattern. So old school method is like that. Each time some new system comes, some new medicines are brought forth, and some new treatment is done, yet patient does not get even relief, because theirs is not based on careful trials and they don't have a proper experience to prove that their medicines work. So that's what this footnote indicates. So thank you. That's all for today. Stay tuned for more.